Hello, this is Dr. Kim Breeden, and I'd like to talk to you about the epidemic of fever phobia. This is just simply the fear of fever. When I'm on call, I get lots of phone calls from worried parents because their child has a fever. Concern is okay, panic is not okay. So we're going to spend a few moments talking about what fever is, what it's used for, and what we need to do about it. First thing, what is a fever? Everybody's familiar with the 98.6 as being a normal temperature. However, if I were to monitor my temperature continuously, my temperature would range between 97 and 100 degrees depending on what I was doing. If the room is very cold, my temperature may be cooler. If I've been very active, my temperature will be higher. Even eating a meal will raise your body temperature. So that temperature will range between 97 and 100 at any given time. When you take your child's temperature, if you see the temperature being 99.8, that's not a fever. That is just a normal fluctuation in the temperature. Medically, we have drawn a line, and that is 100.4, 100.4. Anything below that is not medically considered a fever. Above that it is. Now let me stop right here and say, if your child is less than 2 months old and that fever is 100.4, you need to call the office immediately. We need to speak to you. In very young infants, fever can be a sign of a very serious infection, and we need to talk to you right away. But for older children, we can treat the fever at home. Fever is a good thing. Fever is not dangerous. Fever can scare you, but I'm hoping that by listening to the rest of this, you will not be scared by fever. Fever does a couple of good things. Number one, it fights infection. When a virus or bacteria invades our body, the body defends itself, and the very first line of defense is a fever. Our body's defenses work best at a higher temperature, so we've been designed to spike a fever to help fight the germs. It's a good thing. You can be comfortable that your child is actually fighting the infection. And secondly, it can be a warning sign. Much like the red engine light on your car, it signals us that there's something going on with the child. So when you touch your child and you realize that they have an elevated temperature, then you know that there is something going on that we need to pay attention to. So what do we do about a fever? Again, if your child is less than 2 months old, you need to call the office immediately. But for older infants and children, we will treat the fever at home. There are a couple of products available on the market, Tylenol and Advil, that are used to treat fever in children. Tylenol is recommended for children ages 2 months old and older. Advil is only recommended over 6 months old, so make sure you pick the right product. You will hear of patients who alternate between Tylenol and Advil to treat a fever, and there are many doctors who recommend that. We will only rarely recommend that at our practice for a couple of reasons. Number one, both of those products are different. They have different dosing schedules and different dosing amounts, and there's a lot of room for confusion if you begin to alternate back and forth. Secondly, there are no scientific studies that show that it is safe or effective to mix and match those medications. Now, on occasion, if we have spoken to you and you have a child who has a very high fever and it's very difficult to control, we may recommend you do that, but we always ask that you do that under doctor's guidance and not on your own. You need to know your child's weight. Those medications are based by the child's weight. So when you're in the office, make sure that you jot down a note, put it in your phone, what your child weighs, so that when you need to use a product, you know exactly the right dose. Anytime your child has a fever, you may feel free to call the office. There is a pediatrician on call 24 hours, 7 days a week. So if you have a question about a fever or how to treat the fever, don't panic, just call. Thank you.